Welcome to Sketchy. We take all the super complex stuff you need to learn and turn them into memorable visual stories packed full of everything you need to know on test day. Click the link in the corner or description to try for free for 7 days. Now let's get to it.
Welcome to the Sketchy Seal Show, where with the help of some questionable practices in these sea dogs, we will be covering celiac disease and malabsorption. So grab yourself a gluten-free snack and let's dive in. First things first, celiac disease is actually known by a few different names, including celiac sprue, non-tropical sprue, and the more descriptive gluten-sensitive enteropathy. But they're really all the same thing. An immune-mediated inflammatory disease of the small intestine that is caused by a sensitivity to gluten in genetically predisposed individuals. The overall prevalence of celiac disease ranges from 1 in 80 to 1 in 300 children in the US, Europe, and Australia. In the past, celiac disease typically presented in infants and young children with malabsorption and failure to thrive. However, this has since changed, and it now typically presents between 10 and 40 years old, the coincidental ages of this mother and daughter. This change may be due to the later introduction of gluten into infants' diets and the increased recognition of subclinical disease by screening. It is also twice as common in females than in males, although this may vary depending on how you identify cases. There are also high-risk groups for celiac disease that you should be aware of, as they carry between a 3 to 10-fold greater risk than the general population. This includes those with autoimmune diseases, such as type 1 diabetes, autoimmune thyroiditis, autoimmune liver disease, and juvenile idiopathic arthritis, those with Down syndrome, Turner syndrome, or Williams syndrome, and those who have a close relative with celiac disease. Some would say this high risk should prompt asymptomatic screening, but not all guidelines agree. If you take a look at the left side of the tank, you can see this represented by this high-risk sign, a downtown backdrop for Down syndrome, a seal playing with an antibody arrow for autoimmune diseases, and this little girl's turning X-shaped pinwheel for Turner syndrome. I don't know about pinwheels, but a seal playing with arrows definitely seems high-risk to me. Celiac disease typically presents in young children with GI symptoms, while adolescents and adults will often also exhibit extraintestinal symptoms. Classically, young kids will present with diarrhea, weight loss, and failure to thrive, which you can see represented by this brown puddle, this emaciated trainer, and this falling milk bottle she has just dropped, respectively. Given the high prevalence of celiac disease and the wide availability of testing, all children with unexplained chronic diarrhea should be screened. That being said, up to 10% of patients will instead experience constipation, particularly older kids, which is why our trainer is using a plunger like a sea lion tamer. Kids may also exhibit abdominal pain, bloating and distension, or vomiting. To help you remember this, our rather rotund seal friend has hit his trainer in the stomach with a ball, leaving her green in the face and with belly pain. She clearly still has her work cut out for her with this one. You catch more flies with honey, and you train better seals with cod. Or maybe ahi. It is also important that you keep an eye out for signs of malabsorption in these kids, including any unexplained weight loss and steatorrhea. See our especially skinny trainer's bucket of chunky yellow fat.
Ugh. If that was what I was being fed, I might start hitting people too.
The initial presentation of celiac disease may also include limited growth in the form of failure to thrive or short stature. See this short balancing gnome. And developmental delay. See this seal show delayed sign. It's important to remember that these presentations can vary so widely because there are different categories of celiac disease, including classic, non-GI, and silent or subclinical. Kids with celiac disease may also exhibit behavioral and neurological symptoms, represented by this falling brain hat, such as anxiety, depression, aggressive behavior, sleep problems, and ADHD. Aphthous ulcers and osteomalacia or osteopenia may also be present, and are depicted here by this mouth-like tunnel with erosions, and these chewed-up bone toys, respectively. I guess they don't call them sea dogs for nothing.